Swami. This video is in line with the videos I have given on methods and meditation for the benefit of mankind. This is mainly on hernia. Now, hernia is naturally, everyone have hernia. These are the holes at lower part of your abdomen. Natural holes are there. Now, due to vitiated vent or some kind of, if you lift heavy weights and you don't wear supporters, or you do some kind of exercise, some jumping, you don't wear supporters, so these holes, the nodes and the ligaments of intestines, the little intestines and scrotum and our genital organs, pass through those holes, the ligaments, the cords. Now this makes the situation of hernia dis. The ease has become dis. So this is disease named as hernia. And then according to the movement of the ligaments, they name it a hernia. If the two kinds, one is inguinal hernia, and if those ligaments pass through the thighs, then one is femoral hernia. And suppose at times the baby also have the hernia, the ligaments comes out through the navel, they call it as umbilical hernia. Now, the main reason for this hernia is prolonged constipation. Generally for general people. I had a friend who was Chinese, and he developed hernia. He was playing basketball continuously, so he developed hernia both sides, right and left. His grandmother was an expert, so she lied him in such a position that his pelvic was lifted. By force, she pressed the hernia inside. Now, if you can reduce the hernia by pressure, they call it as reducible hernia. Now, if you cannot, they call it as irreducible hernia. Now, she did it, and she applied some kind of Chinese herbs. The hernia was cured. But it doesn't happen every time. Like, I was having hernia. I kept it for a long time, by practicing yoga, eating herbal medicines. Now, this hernia, this can also happen by taking some wrong things, like some people practicing evil, they give you something and you consume it, and it affects the lower part of the abdomen. This had happened with me also. I've also given this in my books about Double a masher from Ohio, United States of America. He had a student who had the same problem. He massaged that lady, but he had to regularly vomit while doing it so, because a lot of toxins were there in the body of that lady. He sent that lady to other masher. So same way, this can happen by this also. So the idea is to either consume herbal medicines so that the stomach, abdomen is clear for all those toxins you have received. And the general normal medical conditions happens due to prolonged constipation, so then you got to remove constipation by herbal medicine. Take Ayurvedic or anything you can. Or the best way is yogasana. Yogasana acts as a conjunction to all this. So what asanas I'll be showing here are Pavan Muktasana, Vic-free pose, and Viparit Karni, the topsy-turvy pose, and Yoga Mudra for this reason. So I started with Pavan Muktasana. Lift up your one leg, bend that knee, bring towards your chest as easily as possible. Put your mind on breath, count the breath as long as you can without discomfort. Then slowly release your head down, hands down, release your leg, relax. Same way you do with other leg. Now you can do this also while contracting your anus. If you contract your anus, this is known as Ashwini Mudra. You can lift the leg up, hold this at your knee, bend, exhale, and contract your anus as many times as you can easily. Then slowly release your head, release your legs, relax. You do it with the other leg, same thing. You can do this with both the legs up Bring your legs towards your chest, hold your legs, and then again contract. Exhale. Now at this one you exhale and contract your anus as many times you can do as easily. Other pose which I am showing is Viprit Karni. Now Viprit Karni is topsy-turvy pose. You lift your leg up, hold your buttocks and remain in the pose for as long as possible. While you stay in the pose, put your mind on breath. You can contract your anus here also. You can contract the mid part between the anus and the scrotum, which will also affect the ligaments, the nodes and ligaments of your genitals, which has come through the holes, making it hernia. Then, while releasing, bring your legs back, slowly release. The other posture I am showing is Yoga Mudra. Sit in this posture like this. Bend from your waist. Hold your wrist behind. And touch your forehead to the ground. Release. Put your mind on breath. Start counting breath. Remain in the pose as long as possible. You can also do contracting of anus here. Now in all these three poses, you can use this philosophy of Mula Bandha, contract the portion between the anus and scrotum, which is known as Mula Bandha. This affects the genital organs which is being come out or are affected by a vitiated wind. Okay. So